All right. Good afternoon, everyone. Thank you for joining us. Spanish language interpretation is available. To access language interpretation, please click on the globe icon that says interpretation at the bottom of your screen. It may be available in the more icon with the circle and three dots. You may then select Spanish. All right. I see more people joining, so we're going to go ahead and get started. My name is Diana, and I'm an advocacy support specialist at Abriendo Puertas, Opening Doors, also known as APOD. Thank you for joining Leading New Mexico into a Brighter Future, hosted by APOD and UnidosUS. Accompanying me in today's discussion is my colleague, Cristina Gonzalez, Implementation and Advocacy Manager of APOD, Lori Martinez, Executive Director of Engage New Mexico, and Teresa Madrid, Executive Director of Partnership for Community Action. New Mexico is home to more than 1.1 million Latino residents and has the highest percentage of Latinos of any U.S. state. This makes the state an incredible window into the future of Latino families nationwide. Today's conversation builds on insights from the 2025 National Latino Family Report, which highlights the top priorities of New Mexican families: economic opportunity, access to affordable healthcare, immigrant rights, and bilingualism. Together with our panelists, we'll explore what these findings mean for policy, advocacy, and community leadership. As we move forward in the webinar, please use the Q&A function for any questions that you may have for the panelists. Okay, and I want to take a moment to highlight the National Latino Family Report of 2025. I hope that you all can see it on your screens. Okay, so developed in collaboration with APOD, UnidosUS, and BSP Research, the National Latino Family Reports present an overview of the Latino community amidst a dynamic sociopolitical landscape. A survey over 1,500 Latino families with children prenatal through 5 years old, this annual report analyzes the key issues, concerns, and aspirations that shape Latino families' daily lives and vision for the future. These reports are a product of the Latino Infant Initiative, a collaborative effort by APOD and UnidosUS to improve the quality of life for Latino infants prenatal to age 3 and their families. By listening deeply to Latino families, advocates, and program staff, this initiative seeks to influence national priorities and ensure equitable access to high-quality, culturally and linguistically responsive services that support the healthy development and learning of all Latino children, regardless of background. And on the screen, you'll find a QR code to access that annual report, as well as reports from previous years. And now I'd like to hand it over to Cristina, who will provide data from the National Latino Family Report that focus specifically on New Mexico.
Thank you, Diana. Like Diana mentioned earlier this year, we surveyed Latino families across the country and also collected a sample that allows us to spotlight New Mexico. New Mexico has the highest share of Latino residents in the country, and Latino families are central to our workforce and communities. Our data shows that nearly half live in poverty, and cost of living pressures are worsening. Families in New Mexico say that their top issues are inflation and rising household costs. Wages are not keeping up with expenses, and there are affordable housing shortages. If you can see under our economic opportunity section, 48% have highlighted the rising cost of living and inflation. 41% believe that improved wages and income are key, and 35% are concerned about affordable housing. Healthcare is also a major concern for New Mexicans. Also, food affordability is directly affecting family well-being. 86% say lowering food cost is essential for ensuring access to healthy foods. Family support and rely on public programs, and 92% oppose eliminating Head Start. On immigration, we also had New Mexico families oppose mass deportation and support DACA protection and bipartisan immigration reform with pathways to residency and citizenship. Families are resilient, but they are also asking for policies that make sense for New Mexicans across issues, including health, housing, wages, early learning, and immigration. Listening to Latino families means strengthening the future of New Mexico as a whole. Thank you, Diana.
Thank you, Cristina, for grounding us in the data. And now I want to hand it off to the members of our panel. Teresa, I'm so sorry. Can you please start us off?
Yeah, sure. Thank you for having me. I'm honored to join this conversation. As someone who leads an organization that works with families every day, at the Partnership for Community Action, we really engage with the community in four distinct ways. One is investing in people, supporting leadership, development, organizing communities, and influencing systems change. What struck me most about this year's National Latino Family Report is how clearly it reflects what we hear from parents and families across our state. Families are working harder than ever. They're juggling the rising costs of basic needs. They're navigating fear around immigration and trying to give their children a strong start. Yet, despite all of that, the report shows something that New Mexicans embody really well. They embody resilience and aspiration and a deep commitment to their family's future. At PCA, we see every day that families are saving for their future, they're engaging with policymakers, they're leading solutions in their communities. And it's our role at PCA and in the community to honor that leadership, whether it's through classes like that of Abuendo Puertas. Sometimes it's through our microlending program where we help business owners access capital. Sometimes it's through advocacy for programs like baby bonds, which will invest in children at a young age for securing more generational wealth for their families. And sometimes it's sitting in coalitions amongst community to really hear parent voices to influence policy. And for me, the report is a reminder that Latino families know exactly what they need to thrive. And in New Mexico, we have an opportunity and really a responsibility to listen to families, to invest in them, and to build with them for the future of our communities and children.
Thank you, Teresa. And now I'd like to hand it off to Lori to introduce herself and speak to her work in Las Cruces.
Good afternoon. Thank you for having me. My name is Lori Martinez, and I am fortunate to be the executive director of a nonprofit called Engage New Mexico. We focus on southern New Mexico and Doña Ana County, in particularly, where 45.6% of our county speaks a language other than English at home. And New Mexico does have already a high population of Latinos, but in Doña Ana County, those stats are usually higher, so we're at 68%. We serve the borderland, which is it's its own entity. So here in Doña Ana County, we border not only El Paso, Texas, but also Mexico. And so Juarez, Mexico, and El Paso and Doña Ana County, Las Cruces, also make up their own entity. A lot of people also in northern New Mexico don't realize we're even in different media markets. So we get news from different places. And so the issues that we face down here can be they can be more nuanced or a little different. For example, around areas like immigration, where many people don't realize that within 100 miles of the border, we actually have different rights than you all do if you're more than 100 miles outside of the border. So Engage New Mexico, we focus primarily on education. We initiated a countywide partnership called the Success Partnership that focuses on prenatal to career education, primarily systems change. And so while we have, strategic plans that focus specifically on early childhood, and certainly childcare is a big area in that, we also have a Kinder to Career Coalition. And so, for us, there's just so much overlap in these areas. Even though we focus on education, for example, we can't pretend that immigration has nothing to do with that because, we have to have, especially now with what we've seen with ICE, we have to think about like what protections can we put in place so that kids, when they go to school, or parents, when they drop off their kids childcare don't have to worry about whether or not ICE is going to show up and drag them away. So the data in this report, I think is it reflects in some ways what so many of us have been feeling. And that is we see not only the changes, we see the economic uncertainty, but we also see just the changes in how people feel with regards to their safety. And yet within that, I can say that I have never felt more grateful in my life to live in New Mexico, where we have people doing work at the grassroots level that has, built up over the years and really made a difference, especially in early education. We have state legislators who are looking out for us. We have good people in elected office who, at this time in New Mexico, in the state legislature, for example, we have more people who represent everyday New Mexicans than we ever have. We have a majority female legislature. There's some things we can say about New Mexico and protections that we have in New Mexico. That help create, I think, a buffer and hopefully a model for the rest of the country for how we can protect our people during this time.
Thank you, Lori. As a Texan, I can definitely say that we look to our neighbor in New Mexico for what's possible. So I definitely appreciate that insight. And I want to remind everyone that you can use the Q&A function at the bottom of the screen to send any questions to the panel. And there is a comment in the Q&A section. Lori, you mentioned the media market. I'm wondering if you'd be able to speak a little bit more about that.
Sure. Yeah, it's a funny thing. There's a dynamic in New Mexico, right? Because the power base of the state is in Santa Fe and Albuquerque, and that's also where the bulk of the population is. Doña Ana County is the second. We have the second most populated city with Las Cruces. But if you're in northern New Mexico and even up to, I think, Socorro, you're getting news from the Albuquerque media market. We're in the El Paso media market. And so we're getting news from El Paso, we're getting news from the borderland area. There's a different dynamic when you're in the borderland. And I think southern New Mexico in general, just there's regional differences that I think are important to note just within the state itself. And I can say that as someone who grew up in northern New Mexico. My family roots are northern New Mexico and southern Colorado. But I've made southern New Mexico home for, over 20 years now. And those dynamics are just important to recognize.
Thank you. And now I would like to send a question over to Teresa. The report shows that 35% of New Mexico's Latino families are cutting back on family or children's activities due to price increases and the rising cost of living. What policies or investment do you think could help families achieve economic security?
Thank you, Diana. This is so important because these are dollars that are impacting families every single day and impacting their ability to put food on the table. There are policies that we can do right now in this moment, and some of our state legislators, senators, and policymakers have done that in New Mexico. So things like investing in affordable housing and making sure that people have access to resources to purchase a home or to secure, being housed. And what we know is in New Mexico, $110 million was invested in for affordable housing and transitional housing. And so we'll see some of that work coming to fruition this year, especially in this moment where housing is one of the greatest needs. We also know that there is a need for protecting SNAP, and that happened in New Mexico very early on. One of the first states to really show up and say, we're going to protect families' access to some of their basic needs. But then there are programs that are a little more distant, but really can make a difference. So guaranteed income programs or cash transfer programs that can meet the needs of families today, ensuring that they have access to dollars that will let them make choices like being able to pay for a car repair, being able to pay for a medical, cost, And then there's long-term programs, thinking about programs and policies that will invest in children in the future. One of those that PCAs really cares about is baby bonds. Baby bonds is an investment in a child at birth, a publicly funded investment in a child at birth that allows that investment to grow over time. And at the age of 18 to 35, for example, they can access those funds to use for education, home ownership, or investing in their long-term retirement or starting a small business. Those are the types of things that can really change generational wealth, but also change the way that we see cycles of poverty happening for families, generation after generation. So there certainly are ways that we can invest in families today. New Mexico is really showing up and doing that work, but then there's ways that we have to think about the future and invest in ways that we can have economic security going forward.
Absolutely. Thank you, Teresa. There is a question in the Q&A chat. It says, the report shows that 93% of families in New Mexico want their children to be bilingual, higher than the national sample of respondents. What does this mean for how the state should build an early childhood system and K through 12 education system that works for families? And I'll leave that question open to either Teresa or Lori.
Wow, that's an amazing question. Thank you for that. For many of us, we think about this too, and so there are a lot of, I think, things we can be doing, some things that are being done. One, for example, is in early childhood, we know that 14% of our early childhood workforce was born outside this country. And for us, that means likely, in Mexico and our Spanish speakers. And so we also know, like I said, here in Doña Ana County, we have almost 50% of the population who speaks a language other than English at home. We do have families who are saying this is important to us. We want to keep our bilingualism. And what we also know, because we know so much more about the brain than we did even 20 years ago, is that kids who grow up bilingual, it's such an impact on their brain development, and it serves them so well, not only in youth, but also later in life. It also impacts things like questions of identity, which you start to see popping up later when kids are in K-12, those questions of identity that for so long people thought were optional. They have impacts on education. They have impacts on lifetime outcomes. And so we also have in New Mexico, we actually have a lawsuit called the Martinez-Yazzie lawsuit that was brought about because our state constitution mandates certain things for our kids in education. And that's that every kid should have a uniform and equitable, every child should have access to that. And what we found is that we were not doing that for our kids, specifically low income kids, our Native American kids, English language learners, and kids with disabilities. And so it's really important that we support things like dual language programs in our schools, but also not to wait until K-12. There are things that we need to support in early education as well. And so that also means things like supporting the workforce. I just referenced how many of our early childhood education workforce are Spanish speakers, are Spanish speakers only, were born outside the country, and we rely on them. We need them. But also, if you're an early childhood educator in New Mexico and you speak Spanish only, you hit a wall once you get to your associate's degree. You can't go any further than that. And so we need bilingual higher ed programs. We also, if you're a childcare provider, most childcare providers need a credential that's called the Child Development Certificate. And if you're a Spanish speaker, your access to that is limited. So higher ed is slowly catching up in terms of what they offer. But we have to be able to have those things like supports in multiple languages for our families, but also make sure that we're cradling the workforce that provides those with all the supports that they need too.
I think Lori captured that really well. One of the things that New Mexico is celebrating in this moment is the announcement of universal childcare for families in our state. And with that comes an important and critical opportunity to make sure that we have access to childcare, making sure that there are places for children to go to receive that care. And the way in which the state and community members are seeing that possible is by investing in more high quality registered and licensed providers, including home-based childcare providers. We can refer to them as like family, friend, and neighbors who take care of children in their community. And it's in those settings that are often people who can offer care for children in a language that the family prefers. And we know that families, especially Latino families who have a tendency to want their children in spaces that is more home-based, more likely to be cared for by someone who looks more like their family or who is in their neighborhood. The, really supporting those home-based providers to have to offer that quality of care to families in the language that they want is going to be an important step for letting the universal child care come to fruition successfully in the way that families want and need.
Thank you, Teresa and Lori. Before we jump into something that you mentioned, Teresa, of universal childcare, there are quite a few questions in the Q&A section lined up that I'd like to share first. And so Jessica Garcia asks, how can we access this information about all the economic assistance programs that you mentioned earlier, Teresa?
Yeah, so first of all, I just want to highlight in the chat that this particular report is publicly available, so you all can grab the link from the chat or from the website of Abuendo Puertas. Also, the Partnership for Community Action and I'm sure Engage has a website where you could reach out to us. We're happy to share resources. But also, we lean into community organizations and partners who are well resourced to connect families to their needs. And so, you are welcome to email PCA and ask, how can I learn more about things like baby bonds or guaranteed income? And we'll connect you to our coalition, which is really just a community members who show up and learn and get activated and advocate for these policy issue areas. But then when there's a real direct need, like how do I access rental assistance or assistance for my SNAP benefits, that we would lean into other partners who are doing that direct service work and can, really refer you over to them.
Thank you, Teresa. There is a question for Lori. Celeste says, that's such an important point you've raised, Lori, about the different rights we hold compared to those who don't live near the border. It makes me wonder if hosting a Know Your Rights training could really benefit our community. Do you have any thoughts around that, Lori?
Yes, and she's absolutely right. And I think that that's one of the ways, we can protect our communities. I think it's important for us to remember in times like these, this is not the first time in our history that people have been punished for their language, the color of their skin, their traditions. Um, and we're still here, and so I think we use every tool in our toolbox. We use the grassroots systems that we have. I think we're seeing more like mutual aid networks pop up right now. We're seeing more like alert systems, neighbors looking out for each other when ICE is in their neighborhoods. And also certainly Know Your Rights is one of them, because a lot of the work that we do is at the systems level. That's part of what part of our function has been like, how do we get this information out to all these community partners we work with, because many of them are the ones that are working directly with kids and families. And so for early childhood educators, we have organizations. New Mexico is fortunate to have a lot of organizations, and down here we have a few too. One in particular is called New Mexico Cafe, and they'll do things like Know Your Rights trainings. There's also, if you haven't, there's red cards that go around that tell people about their rights in English and Spanish, because, for example, we had ICE showing up, or I mean, nationwide. When ICE shows up, they have to have a judicial warrant. And so sometimes what they've been doing is coming around with administrative warrants that don't have your name on them. They're just very generic. And so for some people, what they would do is they would slide those red cards under the door. Don't open the door. They pass it through the window or under the door, and make sure that people, you have to have making sure that you have to have the right documentation if you're going to try to get someone if you're trying to take them out of the home or even make them leave their home, for that matter. And also, there's some things too that are just about how do we capture and bear witness? Because we do see people's rights being stomped all over. We're seeing people in masks literally kidnapping people off the street. And so sometimes what we can do, if our only option at that time is to bear witness, capture it on video, use your phone, again, we use every tool in our toolbox.
Yes, thank you, Lori. Very great points. And I want to address a comment in the Q&A section going back to bilingualism. Jessica says that yes, bilingual education is important, but so are classes in English that are more effective and more easily accessible for adults. And I'm wondering if either of you have anything to add to that.
Lori talked a little bit about this in particular when we think about childcare providers, which is some of the work that we've been doing in partnership, is making sure that we begin to work with our systems in higher education to offer those classes and programs that allow uh, individuals who speak Spanish or languages other than English to access higher education, and for us to really invest in resourced ways for them to connect to that learning so that they can enter the workforce at levels that offer them higher wages or dignified wages. And it's not just in childcare, it's in all aspects, right? And we have to diversify the way that we offer these learning opportunities. Oftentimes, community organizations like ours offer those things in-house, but really where we hit a stopping point is when um, uh, higher education or credentialing gets involved, which is often needed for things like childcare. We're not credentialed to offer those things, right? Like there's a few things we can do for um, continuous learning credit hours that providers can receive, and those are approved by the state. But it's really our higher education systems that need to invest in professors or teachers who can speak languages other than English, and also offer those at times that are available for community members to attend. When we think about, and I'm focusing on childcare providers because that's some of the work we're doing, but there are many careers and fields where individuals are working all day and or all weekend or whatever the scenario is, that it's in those moments where they have to work and study, right? And we tell people to invest in themselves, to show up and increase their skills so they can get better wages. And that's all great, but then we have to offer those opportunities in times and spaces that are available to those community members, specifically our Latino families and our Spanish speaking families, to access those resources. And we have to provide those opportunities to them.
The only thing I would add to that is just to touch on what Teresa said about offering in different, I think, formats and places too. Certainly higher ed. Um, but for example, here in the Las Cruces Public School District, they have family welcome centers where they'll have English classes for families. You have to think about, there's the formal education places that we're used to, but also where are what works for people, in terms of building into their schedules already, if they're working, if they have families, but also where are they going to feel safe? We saw not 2 weeks after this administration was sworn in, we already saw people hesitating to send their kids to school down here or even access early childhood services, and that was only 2 weeks in. So thinking about what things can be offered online, what things can be offered through friendly messengers. So down here we use promotoras, people call them community health workers, but promotoras because they're the friendly and trusted and known messengers in communities. So, thinking about what are the spaces in community we have where people can get the resources they need, but also where they can feel safer.
Yes, thank you both for those perspectives. And I couldn't agree more that meeting the community where they are and making sure that these services are accessible is of utmost importance. We have another question in the chat from an anonymous attendee, and I'll offer it to both of you. What can other states learn about how New Mexico has been able to get universal childcare access and other big investments? What's next for New Mexico around early childhood and family well-being?
Yeah, thank you for the question. I'll jump in, and I know Lori, if will also have lots to share. I think the first thing I want to say about how New Mexico has been able to get universal childcare access is that this is not something that started in this moment, but really began over a decade ago with community organizations, community members across the entire states doing some grassroots organizing to create funds in the state level that would invest in early child care education. And so it took 10 years to put Constitutional Amendment 1 on the ballot, which passed with over 70% vote to invest in our children and our early child care system in New Mexico. And so with that being voted in 2022, it really gave us the trajectory to move in the direction of providing what is needed for families and children. And universal childcare is just one of those outcomes that has come to fruition in a lot of ways. What we know about universal childcare is that this proposal will save New Mexico families an average of $12,000 per child, especially for those families who have infants. Infant childcare costs 86% more than in-state tuition at a four-year public college and 10% more than the average rent. People cannot afford childcare for an infant. But it's incredibly important that the universal childcare system really focus on and create ways for equitable access to childcare across the state so that those families who need it the most, those families who are in rural areas of the state have access to childcare. And for that reason, it'll be really important that the state also invest in supporting the opening of new childcare centers or registered and licensed childcare homes across the state where there are childcare deserts. And with that comes an incredible need to invest in wages, dignified wages for childcare providers. And so there's some work to be done there about how does all of this come together. I'll let Lori jump in.
Oh man, this is the big question, right? Because there's so much we can say. I love what Teresa touched on. First there was the creation of dedicated funding streams for early childhood, so the Land Grant Permanent Fund, creation of the Early Childhood Trust Fund. Also, there was momentum and also years-long effort towards creating a cabinet level early childhood education and care department. So acknowledging, to the world of early childhood, because all our programs before in early childhood statewide, they were captured under different statewide departments. So under the Department of Health, under Children, Youth, and Families, under our Public Education Department. And it was really important to get those different universes of childcare together under one kind of ecosystem or one umbrella. And so having a dedicated cabinet level department that's really been about that has been important. We've needed the targeted investment. So like Teresa said, maybe the attention on New Mexico is new, but the efforts definitely are not. And so, for example, the universal childcare announcement is getting a lot of momentum right now, but it was actually a couple of years ago, after the pandemic, that New Mexico increased childcare assistance for parents from previously it was 200% of the poverty level. But the reality was, if you were at 200% of the poverty level on paper, you were eligible, but you had to be poorer than that to actually get to childcare assistance. If you were at 200%, you would, in all likelihood, be on a waiting list for a while. And so what New Mexico did that was groundbreaking a few years ago is they increased the eligibility to 400% of the federal poverty level, which effectively made it free for most families in New Mexico at that time. And I got to tell you, that's when I did my little happy dance, because that's what I didn't think I would see that in my lifetime. And so that's been huge. And so, this with the universal childcare announcement now, what it's doing is taking just any of that remaining families that were left out, including undocumented kids who deserve access to that quality care as well. And I think also we've had to really work to look at how do we protect. We have what we call a mixed delivery system, which just means that we have public and private providers that provide childcare, both home-based and center-based, and we need a mixed delivery system. There's just no way we're going to meet the need for childcare in our state without having both public and private providers, and having the childcare assistance, having them both be eligible for childcare assistance for the sustainability of their businesses or for their programs. Down in Doña Ana County, historically, we have relied on home-based providers at a higher rate than the rest of the state. I mean, the state as a whole depends on them, but in Doña Ana County, our numbers are always a little higher. And I think people have to recognize that too, especially when it comes to Latino families, because they're more likely to say that they want a family member or a trusted friend to be the one watching their kids. And so, the importance of having that support for the home-based providers has been huge too. Another thing was that historically how the state would reimburse providers was based on like this federal equation that was pretty outdated. And so New Mexico started looking at, okay, what does it actually cost to provide quality childcare? Because if it actually costs this much, then we shouldn't be reimbursing people this much. We should be reimbursing them at what it actually costs to provide the quality care, because otherwise you have what we've had for generations, which is it's been the childcare providers. We have subsidized childcare in New Mexico on the backs of brown women for generations. And so, we provide, historically, there have been investments in technology and all kinds of things that the state has subsidized. And finally, those things are starting to catch up, like that we need to make those investments in our workforce, in our people. And we're starting to see those investments work. So I can tell you, if I can share my screen, I could show you, but we have a community partner down here that runs data for us specifically for Doña Ana County. So one of the things we just updated last month, or that they updated for us last month, is that we can see from 2023 to 2024, our childcare workforce in Doña Ana County almost doubled. And also we can see that for New Mexico, it jumped from 2,180 up to 3,460. And so, I think there's a lot of reasons those are working, but I think some of the targeted investments in childcare workers and I think our state's starting to really grapple with and understand the importance of early childhood education and these workers. There's man, I could go on and on and on, but I'll stop there.
No, thank you both for your insight and your analysis. And we have two questions in the Q&A chat. Damien asks, many of your themes overlap with what we're hearing on the ground through community listening sessions in southern New Mexico. Are there resources to help bridge national insights with local civic conversations?
That is such a good question. Lori, you're gonna have to help me here. I don't know if there are resources that bridge the two. And I do think, what New Mexico is really good at is on the ground, community-led coalition work. Some even describe New Mexico as a coalition-heavy state. And it just means that people are sitting around the table having these conversations and talking about how do we influence the change that we need to address these issues. And so, would love to be connected, Damien, if we're not already, in thinking about how do we have everyone at the table who wants to be there to join the conversation and move some of these policies that will impact what we're talking about here with universal childcare, with economic security of families, immigration. There are so many spaces where people are having these conversations.
Yeah, that's a big one. And for those who don't know, Damian Willis is a journalist here in southern New Mexico. So representing, gotta appreciate that. I think one thing, Damian, is just that's important and huge in that conversation is we need good journalists. We need good people like you who are making sure that the public is getting access to accurate information in real time. Because we know that so many of like our large news sources in recent years have been taken over by corporate media, who has agendas, you know? And so how do you make sure that the people in your communities continue to get accurate information, that they have avenues for receiving that information, but also avenues for expressing it? I think when local journalism connects or collaborates with other sources, when we have things like town halls or creating different avenues for people to um, to put themselves out there, really. Some people will go to a town hall, but some people are never going to speak up in public and see, what are the other avenues we can use, whether it's written or social media, or, how do we make sure that we are truly capturing the voices of the people in our community and getting a representative idea and not just having the voices of the few overshadow the experience of the many.
Thank you. Thank you both. An excellent question. Another one that we have from an anonymous attendee is, what strategies or approaches have you found effective for uplifting the voices of families in New Mexico, especially those who are hard to reach or may not have easy access to resources? How can organizations and policymakers ensure that families are heard and included in decision making? And I offer this question to both of y'all.
Well, I mentioned that New Mexico is a coalition heavy state, and I think that that comes with so much value of allowing community family members to have their voice be heard. It's in those spaces there's so much power, the peer-to-peer power in space together for people to acknowledge and recognize that on the ground, community members have a voice, that they have so much knowledge, so much lived experience, and they have solutions. And it's our responsibility as organizations, but also as community members, to hold our state representatives, our elected officials, our state departments accountable to serving the people in our state. We talk about the data in this report, and the representation in New Mexico is primarily Latino families. It is the voice of those Latino families that can ask for access to language resources, access to educational resources, access to resources and services that help alleviate economics, security, and supports. And so I think these coalition spaces have created many, many opportunities for people to be activated and agitated around issues that matter to them most. But then it's also the responsibility of our elected officials, policymakers, and departments to listen and to pause and listen and to create space and opportunity for those people to be in relationship with them, to really influence the systems change work that we really want and desire. Organizations like PCA and Engage are doing this work, but there are organizations on every corner of this state who are convening families and community members to identify policies or issue areas that are important in their own pockets of the state. And so the other thing that is really important is that our state departments, policymakers, stakeholders go to communities. That is one way that we can influence change, is making sure that we hold them accountable to showing up in rural areas of the state, in showing up in tribal and Pueblo nations, showing up to community events and centers where people and family are, rather than asking families to travel to Santa Fe, where our roundhouse is, or to Albuquerque, where, because we're a larger city, we convene here so often. We have to take our policymakers to community.
Yeah, I think the only thing I would add to that too is that, people can use their individual voices, and we're fortunate, I think, to have in our state a lot of elected officials who make themselves available um, to the general public, as really they all should. But I think there's the individual voices, but I think what Teresa said about the coalition work, one of the things that's powerful about that is that you don't have to agree on everything, but you look at like what are your common goals and where can you raise your voices together. Because it's one thing if I have like myself with Engage New Mexico coming to an elected leader or decision making body with something, but it's even more powerful if you have a coalition with a bunch of organizations saying, hey, you need to pay attention to this. Our communities are telling us this. Why are you doing that? So that collective voice, and that it's shared power. One of the things that I think has been so powerful is having to, in systems work, is you really have to rethink your systems, which means you have to question what has been the standard hierarchy or use or structure of power, and has it been working? You know, sometimes we don't even ask like why these systems that have been in place for so long, how they got there in the first place. And I think a lot of the ground that we've gained in early childhood in the last decade has been saying there were things here that weren't working. Why are we holding on to them? You know, this is clearly not working for our people, so let's do something different. And you know, that can be, I think that's a huge thing for people to grapple with, is this work is external, but it's also internal. Um, Exploring what it is that keeps us from looking at different ways of doing things. Is it a deficits mindset? Is it just good old fear, you know? But there, when you bring community into places where they can talk about these things together and give voice to that, sometimes that fear loses its power, you know. And then you can think about, you know, and I think that's why there is such power in bringing people together, um, and having those conversations, because then you give voice to, not only to people's fears but also to the solutions, and the synergy and the energy that comes about that wouldn't have just with one person. So I know that was kind of a ambiguous answer, but there is an X factor in all of this work, you know, and it's that, I think it's that community piece and the what happens that's not predictable sometimes, you know, when you bring people together for solutions.
Agreed, and thank you for that perspective. I want to keep in mind what y'all are saying about holding legislators accountable and also the power of community and organizations in the community while shifting towards a topic that was also highlighted in this report, healthcare. And so my question is, Latino families in New Mexico express strong concerns about the accessibility and affordability of healthcare. What actions can state legislators take to ensure New Mexicans have access to high quality, affordable health care? And how can partnerships between government, philanthropy, and community-based organization reduce these economic pressures? And I offer that to the panel.
Yeah, thank you, Jenna. New Mexicans rely on Medicaid at nearly twice the national rate, and we know that New Mexico parents say that lowering healthcare costs is urgent. And at the same time, we are existing in a political climate in this moment where there is policy decisions being made at the federal level impacting our cost on healthcare, our access to care, and our insurance rates. And so just recently, we are so appreciative that our state leaders have approved a state health insurance subsidy in New Mexico that will protect families from experiencing the higher increases in rates in the exchange. And so that's an important and critical way that we protect families locally from these insurance rates. But we also have to be thinking about what are the ways in which that families access care. So for some families, they have to drive 200 miles to get to a healthcare provider in this state. And so we have to start thinking about what are policies or solutions for increasing the number of providers across New Mexico. We have 33 counties in this state, and I think it's something like 30 out of 33 of the counties are considered frontier counties when it comes to healthcare, meaning they have to drive hundreds of miles to get a healthcare provider. And so we got to start asking questions and addressing those issues with policy solutions.
Thank you, Teresa. Lori, I'm not sure if you had something to add, but please feel free.
Yeah. I think there's a few things wrapped up in that. I think also, you know, we have I think like the rest of the country, but we see it in New Mexico too, we have a provider shortage. And again, like Teresa said, especially in the rural areas, or even what's even considered more rural, which is the frontier areas. Um, and so I think there are things we should be looking at, like how can the state be holding MCOs accountable, for example? If you're, for example, in like mental health, because that's just the world that I'm partly coming from, is if like if I'm a psychologist in New Mexico, um, I'm getting reimbursed a certain rate from an MCO, like Blue Cross Blue Shield or Presbyterian or whomever. But in another state, that MCO may be reimbursing psychologists at a higher rate. And so one thing is, how can New Mexico legislators be working with the ones who are holding that power up there around how they're reimbursing New Mexico providers relative to other states? Because the reimbursement rates are a big element in retaining providers in the state. I think, there's also some work being done on medical compacts so that medical, like licensure, for example, can transfer more easily and credentials can transfer more easily from one state to another. The other that Teresa kind of touched on too is just when you're hundreds of miles away, transportation issues touch almost every other issue in New Mexico. And so if you want people to have access to healthcare, you have to make sure they have access to transportation too. And also, one of the things about the pandemic that ended up being a good thing is that pre-pandemic, there had been so much more, I think, resistance to the idea of virtual services, for healthcare. And so for a lot of people, for example, being able to get their therapy services or even like some home visiting services went online too. So just that, again, there's multiple modes of providing care. And so just looking at like what's appropriate to the needs of the situation and the families is a big one. And I don't know if you're going to talk about this or not, but the other thing too is that we've had, a lot of our hospitals are owned by private equity now. And with that, we've seen the quality of care go down. And I think that's something we really have to keep an eye on, when you have out-of-state interests coming into your state and their number one priority is making sure that their shareholders receive profits, then it's not about healthcare anymore. And so, I think we have to look at what kinds of state laws and what kind of protections can we put in place to protect New Mexicans when that happens. And also back to childcare, we're watching out for that in childcare too, because there's private equity in childcare and they're trying to come to New Mexico. And so, when we look at New Mexico and childcare, so many of the businesses, they're small businesses, they're local, they're small businesses. And so how do we protect that versus just having outside interests come in and capitalize on all the investments that New Mexico's made in quality care?
Yes, thank you both for your analysis and those reminders too. And there's one more question in the Q&A section from Damien that I'll offer to both of y'all. What's the one thing you most hope local journalists take away from this report?
Ooh, no pressure. This report is a narrative about how Latino families have power. It is, it shows that families are informed about the issues that matter most to them in this state, that we walk away understanding economic security, early childhood well-being are threads running through this report. They want stable income, access to childcare, pathways to opportunity, and protection from fear of immigration policies that harm them and their families. Um, Listening to Latino families, especially in this state, is not optional. This is the majority of our state voice. And so we have to listen to families and we have to learn from this data and show up ready to respond to the greatest needs that families have.
Yeah, that was great, Teresa. Thank you. Man, Damien, one thing, huh? Um, there's so many things, but something that's worth pointing out, and one of the highlights of the report was that 66% of New Mexico survey participants believe the current president's economic policies will negatively impact the family's financial situation, and a similar amount will believe it will negatively affect the overall U.S. economy. How loud do families have to scream before we listen to them? Really? They're not begging for riches. They're begging to provide the basics for their kids. They want homes to live in. They want enough food for their families. They want to be safe from being taken off the streets. They want future and hope for the kids. same things we all want, right? And I think in that it's listening isn't optional, and acting isn't optional. And so for the people in our state who have power at the local level, at the state level, at the federal level, um, that accountability to make sure they are making decisions that benefit the people of New Mexico is more important than ever. And that includes journalists holding them accountable. But really, it's all of us.
Thank you both. That's very well said. And as we close, I'd like to know from each of you what gives you hope about the future of Latino families in New Mexico?
I'll start with that one. It's us, it's our communities. I talked earlier about using every tool in our toolbox, and I think one of the things for me that's hopeful about that is because we see our communities reaching into every tool in our toolbox. It's the lobbying and the advocacy work, it's talking to our elected officials, but it's also the things that our ancestors passed down to us. It's the prayer, it's the traditions, the ceremony, it's the language, it's the reaching for each other in community. And it's like I said earlier, I'm grateful to live in New Mexico always, but especially in this time. I'm very proud of where I live.
There's such a deep sense of community and family and connection and relationship in New Mexico. I know when partners come from outside the state to New Mexico and have opportunity to sit in space with families and community members, that's the one thing they name is, wow, there's just so much connection and deeply rooted relationships here. And so that gives me hope because at an organization like PCA, we really want to create safe spaces for families to show up as leaders that they are. We want to build power with families and really let them name the solutions. They know the solutions, they have the lived experience. And so seeing them show up ready and oriented toward positive solution making for themselves and the generations to come is just really inspiring. So we have the honor to do that pretty frequently. And so it's in those relationships and in those conversations that give me hope.
Thank you both so much. And thank you to Cristina as well for sharing your insights and leadership, and to UnidosUS for your continued partnership. It's clear that New Mexico's families are showing us what resilience looks like, and our collective work ensures that their voices shape a brighter, more equitable future. And thank you everyone for joining us, and to those watching this recording. We invite you to read the full report and to stay connected with APOD and UnidosUS for future dialogues like this. So thank you so much, everyone.